35 years in a shallow tide, nowhere to run and nowhere to hide from the sound of the engine, the rattling chest. A lifetime of waking but never a rest. The first one complained of the thunder I made while I drifted in shadows, feeling afraid of the air that stayed stuck in the back of my throat. A heavy-set man in a leaking boat, and the CPAP hums a lullaby under a cold and artificial sky. 5 years of clicking, 5 years of blue. The silence is there, but the ghost is too. Am I too far gone? Is the damage deep? In the oxygen I failed to keep. I'm breathing now, but I'm still so tired, like a burned out house that was poorly wired. Surgeon's knife offered a year or two, but the weight kept climbing and the darkness grew. A fog in the morning, a cloud in the head, dragging the anchor from the edge of the bed. The new one is kind, she doesn't complain. She sleeps through the hum and the soft window pane, but she doesn't see the hollow inside where the spark of the engine slowly died. And the CPAP hums a lullaby under a cold and artificial sky. 5 years of clicking, 5 years of blue. The silence is there, but the ghost is too. Am I too far gone? Is the damage deep? In the oxygen I failed to keep. I'm breathing now, but I'm still so tired, like a burned out house that was poorly wired. They say the brain is a resilient thing, that it learns how to heal, it learns how to sing. But when the cells have been starved for a decade or three, you start to wonder what's left of me. Is it the apnea, or is it the soul? Or just the years taking their final toll? The mask is on, the seals are tight, but I'm still searching for the light. Am I too far gone? Is the damage deep? In the oxygen I failed to keep. I'm breathing now, but I'm still so tired, like a burned out house that was poorly wired. The air goes in air goes out. 5 years of quiet, a lifetime of doubt.
Semmoinen elämä.
What is name of this?
Mikä se on?
Ngaataminen.
Mikä?
Fish.
Fish?
Fish based rice. Or
No.
fish rice, no?
Ngaataminen is like with tomato
Yeah.
and fish, and you like
Tomato and fish and ball.
Make a ball.
Okei. Nyt on... spoon.
Se soup. Spoon is a soup. So, spoon is a soup. Laita soup siellä. No.
Yeah.
For the soup, this is too you can eat.
Okay.
Se on ihan tavallinen. Se on. Semmoinen.
Nice. Very nice, very nice.
Shan traditional fish rice ball.
Hyvä.
Sitten se pitää sitä pinäpiä.
Mitä tässä? What is this?
Cabbage.
Kaali.
Cabbage. Kaalis. Ei kaali. Cabbage.
Cabbage. Hyvä.
How CPAP treatment for sleep apnea affects mood hormones and mental health. CPAP, continuous positive airway pressure, therapy is the gold standard for treating sleep apnea, and its effects extend far beyond just stopping snoring or daytime sleepiness. When breathing interruptions are eliminated, the body's chemical balance begins to restore itself. 1. Effects on mood hormones and neurotransmitters. The constant oxygen deprivation and sleep fragmentation, microarousals caused by sleep apnea, keep the body in a perpetual state of stress. CPAP therapy calms this cycle. Cortisol, the stress hormone. Untreated sleep apnea raises nighttime cortisol levels because every breathing pause triggers a small fight or flight response. CPAP therapy lowers cortisol, reducing chronic stress and anxiety. Dopamine and serotonin. Deep sleep is essential for the regeneration of neurotransmitters. When sleep quality improves, the brain's ability to regulate pleasure, dopamine, and emotional stability, serotonin enhances. This specifically helps with irritability and low mood. Testosterone in men, sleep apnea often lowers testosterone levels. Since most testosterone is secreted during a REM and deep sleep, CPAP therapy can restore these levels, directly improving quality of life, alertness, and mood. 2. Broader impacts on mental health. CPAP therapy is not just a physical aid. It often serves as a significant support in treating mental health challenges. Relief of depression and anxiety studies show that many sleep apnea patients suffer from depressive symptoms caused directly by poor sleep quality. When the brain receives sufficient oxygen and rest, cognitive load lightens and depressive symptoms can alleviate significantly, sometimes even faster than with medication alone. Cognitive performance and brain fog. Sleep apnea often causes brain fog, memory lapses, and difficulty concentrating. CPAP therapy improves working memory and attention span. It reduces cognitive exhaustion, making it easier to manage the challenges of daily life. Emotional regulation. A tired brain reacts more intensely to negative stimuli and overactive amygdala. With CPAP therapy, emotional control improves. You are no longer as easily irritated, tearful, or impulsive. 3. Summary of changes before and after treatment. The transition from untreated sleep apnea to consistent CPAP use brings about significant physiological and mental shifts. Before starting treatment, cortisol levels are typically elevated due to a constant state of stress, but they drop and allow the body to calm down once therapy begins. While a patient's mood is often characterized by irritability or depression prior to treatment, it becomes much more stable and positive with the help of the device. Furthermore, the brain fog and memory lapses common in untreated patients are replaced by clearer thinking and better concentration. Ultimately, the interrupted and non-restrictive sleep of apnea sufferer transforms into deep healing rest through regular CPAP use. Important note, these effects may not appear overnight. Hormonal balancing and mood improvement often take anywhere from a few weeks to a few months of consistent use. Thank you for your time. See you in the next video.